I'm Dr. Obiajulu Christian Ezeigwe. I'm here to present on the effect of ethyl acetate fraction of Costus afer on essential haematological and biochemical indices of streptozotocin-induced diabetic rats. Diabetes mellitus is a chronic condition. It is a chronic condition in which a person has abnormally high blood sugar level. Diabetes is a disorder characterized by impaired metabolism of carbohydrates, proteins, and fats due to inadequate or inefficient activity of insulin. According to the American Diabetes Association 2014, about 90 to 95% of diabetes mellitus cases are type 2. So a procedural review and statistical analysis that combines the results of multiple scientific studies reveal that type 2 diabetes mellitus increases the development of processes of non-alcoholic fatty liver disease. Costus afer of the family Costacea is found in moist and sometimes shady forests, including riverbanks of tropical West Africa. It is a total perennial herbaceous and unbranched tropical plant with creepy rhizome. It is usually called ginger lily or bush cane. The southeastern Igbo part of Nigeria calls it okpete or opoto. And then the northern, that is the Hausa part of Nigeria, call it kakezawa. In the western part, Yoruba of Nigeria, it is called irene, omode, and called mbretem in Efik. What has raised further interest in this research? The high cost of conventional drugs and their attendant side effects has hindered the treatment of diabetes. Thus, attention is geared towards the use of medicinal plants with reduced or no side effects at all for the treatment and management of diabetes mellitus. Types of diabetes mellitus. For us to understand the types of diabetes mellitus, we need to understand the insulin, how insulin is secreted, and how the role insulin plays in the utilization of glucose in the cells. Whether we know that insulin is a hormone secreted by the beta cells of the pancreas. The pancreas secretes 4 cells. The pancreas has 4 cells. It has the beta cells that secretes insulin. It has the alpha cells. The alpha cells of the beta cell of the alpha cells of the pancreas produce glucagon. And then the gamma cells of the pancreas secretes somatostatin. And then somatostatin tries to maintain a balance between glucagon and insulin, ensuring that glucagon and insulin are not secreted at the same time by the pancreatic beta cell, by the pancreatic areas of Langerhans. And so these beta cells are responsible for the secretion of insulin. So in type 1 diabetes mellitus, we'll find out that the insulin secreted is not sufficient. So in a situation where insulin is not sufficient to mobilize the glucose transporters to transport glucose from the blood to the cells, the individual begins to suffer from type 1 diabetes. And so this type 1 diabetes is more pronounced in children and young adults before the age of 30 years. Then type 2 diabetes mellitus has to do with insulin. In this case, insulin is secreted by the beta cells of the pancreas, but because of insulin resistance or insulin insensitivity to its receptors, it leads to diabetes mellitus type 2. In this case, the insulin might become insensitive to the insulin receptor because it is the binding of insulin to the insulin receptors that leads to the signaling pathways that will lead to the mobilization of the glucose transporters that transports glucose from the blood to the cells where they are needed. So in a situation where the insulin is available, but it's insensitive to the insulin receptors, then it is going to result to type 2 diabetes. And so type 2 diabetes occurs more in adulthood, largely occurring in obese people over 40 years of age. It can be caused by insulin resistance or insensitivity. Now, what are the signs and symptoms of diabetes mellitus? A patient who is suffering from diabetes will be suffering from polydipsia. Polydipsia has to do with excessive thirst. And so why will he be suffering from excessive thirst? You know, at this point when glucose begins to float in the blood, there will be need for the cells to begin to lose their intracellular water to the blood in order to dilute the high glucose concentration in the blood. And so as they lose their intracellular water to the blood, the individual will begin to suffer from thirst, excessive thirst, that is polydipsia. And so as the person suffers from excessive thirst, because glucose cannot be transported to the cells, the individual will also suffer from what we call polyphagia, that is excessive hunger. At the same time, the patient will want to take more water, and he takes more water because of the excessive thirst, polydipsia. He takes more water. You'll be urinating frequently. So you also notice that one of the signs of diabetes is excessive urination, and that is polyuria. And so when you test the urine, you carry out analysis on the urine of the patient, you see traces of glucose in the urine, and that is what we call glycosuria. Also, such an individual will be suffering from unusual weight loss. There's going to be increased fatigue, that is serious tiredness. There's going to be ketonemia, that is the position of high quantities of ketone bodies, abnormally high quantities of ketone bodies in the blood, and abnormally high quantity of ketone bodies in urine, that is ketonuria. And so these are some of the symptoms you will see in an individual suffering from diabetes. And then talking about the high complications of diabetes, sometimes we even notice fat embolism. That is the position of fat in the walls of the heart. And when that happens, the individual will begin to suffer from narrowing of the blood vessels, which might, at the long run, lead to high blood pressure because of the narrowing of the blood vessels. So that is some of the complications that can follow diabetes. Now, having known what diabetes is all about, let's talk about the treatment of diabetes. There are conventional drugs for the treatment of diabetes. We have insulin and insulin preparations, which are employed only parenterally, and oral hypoglycemic drug, which can be administered orally. The two major oral hypoglycemic drugs are sulfonylureas, and these sulfonylureas directly stimulates the release of insulin from pancreatic beta cells and thereby lower blood glucose concentrations. Because they work by stimulating insulin secretion, they are useful only in patients with some beta cell function. And so for the biguanides or the metformins, they decrease blood glucose levels by decreasing hepatic glucose production, decreasing the intestinal absorption of glucose, and increasing insulin sensitivity by increasing peripheral glucose uptake and utilization. These conventional drugs are used, but sometimes there are adverse effects of these conventional drugs, and some of these adverse effects include weight gain and hypoglycemia in the course of treatment. And so research has been geared towards the use of herbal remedies. And there are herbal remedies I've used for the treatment of diabetes in the past. With simple cannon has been used, Anoma moricata, Josephia carnia, Abrus precatoris, and some of these herbal remedies have been used. And in this presentation, I have used ethyl acetate fraction of Costus afer for the treatment of diabetes. Now, what's the statement of the problem? The high cost of conventional drugs used in the treatment of diabetes, as well as the attendant undesirable side effects and contraindications, has continued to impede the successful treatment of diabetes. This has triggered a recourse to complementary alternative medicine in the treatment of diabetes without investigating their propriety, following up their moderatory effects on essential biochemical parameters and organ system functions. Aim and objectives. The aim of this study is to investigate the efficacy of ethyl acetate fraction of Costus afer leaves on some essential biochemical parameters of streptozotocin-induced diabetic mellitus. And the objective includes to determine the acute toxicity effect of the aqueous and endothelial extracts of neem leaves, to determine the effect of ethyl acetate fraction of Costus afer leaves on haematological parameters such as the packed cell volume, hemoglobin, red blood cells, white blood cells, and platelets of streptozotocin-induced diabetic rats. Also to determine the effect of ethyl acetate fraction of Costus afer leaves on lipid profile of streptozotocin-induced diabetic rats. Also, we will go further to establish the fraction, if the fraction has any protective effect on the severity of diabetes mellitus, and also to find out whether it has a capability of delaying the onset of diabetes. That is why in the study, we have some groups of the animals that we have to pre-treat for a period of 1 month before the induction of diabetes, and we have groups that will induce diabetes and treated. The essence of the pre-treatment period is to see whether the extract has the capability, that is the fraction of Costus afer has the capability to prevent the onset and delay the onset of diabetes mellitus. Now, the relevance of the study, the economic burden of diabetes is enormous in terms of the direct costs of intensive monitoring and control of blood glucose and managing cardiovascular, renal, and radiological consequences. The high cost of conventional drugs for the treatment of diabetes and the concomitant undesirable side effects poses a serious challenge in the management of diabetes. And so there is a worldwide renewed interest in herbal drugs and in preventive medicine. Any herbal remedy that will protect the onset of diabetes or be efficacious in its treatment without upstaging essential biochemical parameters and organ system functions will be a worldwide relief. Significance of the study. If this herbal extract is proven to be efficacious in the prevention or treatment of diabetes without eliciting undesirable effects in biochemical parameters and organ system functions, then it will be a great relief in the treatment and general management of diabetes. This will enhance general Medicare of diabetics and diabetes-prone individuals, increase life expectancy, and reduce the overall cost of treating or managing diabetes. Now we get to the methods I used in my research. Sample collection and authentication. The leaves of Costus afer were freshly collected at 3:30 p.m. at Obiajulu, local government area of Enugu State, Nigeria. After the collection, it was identified by a taxonomist in the Faculty of Biosciences, Nnamdi Ezeigwe University, Awka, Nigeria. The voucher number is represented at the herbarium of the Department of Botany, Nnamdi Ezeigwe University, is 9H/166. Preparation of the crude extract. The leaves were properly washed and dried at room temperature for 3 weeks. The dry leaves were ground into a fine powder using a Corona manual grinder. 2 kg of the pulverized leaf powder was soaked in 5 liters of 70% ethanol for 24 hours for complete extraction. The ethanol mixture was sieved using a muslin cloth and thereafter filtered with Workman #1 filter paper. The filtrate was concentrated using a water bath at 50 degrees Celsius. And so the biological yield of the extract after extraction was 118.2 grams. The ethanol extract was put in universal bottles and preserved in the refrigerator until use. Fractionation of the extract. The extract was fractionated according to the method of Wu et al. We started the fractionation by using highly polar solvents like N-hexane, chloroform, followed by an extract and a solvent that was able to extract partially polar and partially non-polar constituents of the Costus afer extract, and that is ethyl acetate. And then we also proceeded using N-butanol for the extraction. And so when we studied these different fractions, we were able to find out that ethyl acetate fraction was more effective in ameliorating diabetes. And so the study concentrates on the ethyl acetate fraction of Costus afer. Experimental animals, 48 male rats of Worcester strain of 10 to 12 weeks old, weighing between 150 plus or minus 10 grams, bred in the animal house of Chris experimental animal farms were purchased and used for the study. 13 rats were used for acute toxicity study, while the remaining 35 were used for diabetes studies. The rats were maintained in sizable aluminum cages in the Department of Applied Biochemistry Laboratory in Azikiwe University under standard environmental conditions, with free access to rat feed and water. The animals were acclimatized for a period of 2 weeks before being used for the research. The cage beddings, feed trough, and water bottles were cleaned daily throughout the period of the experiment. Acute toxicity study. The methods that are employed in the acute toxicity study is Lucky's method of 1983. In the first stage of the acute toxicity study, the animals were weighed and sorted into 3 groups of 3 rats each as follows. Group A was given 10 mg per kg body weight of Costus afer, ethyl acetate fraction, and then Group B, 100 mg per kg of Costus afer, ethyl acetate fraction. Group C, 1000 mg per kg body weight of a Costus afer, ethyl acetate fraction. And they were allowed to stay for 24 hours, and they were monitored for signs and symptoms of toxicity, such as drowsiness, trembling. And then after 24 hours, the next set of animals were brought out, and that is Group D now, 1,600 mg per kg body weight of Costus afer was administered, and Group E, 2,900 mg per kg body weight was administered, and then Group F given 5,000 mg per kg body weight of Costus afer, and then the animals were again monitored for 24 hours, and eventually all the animals were kept up to 14 days to observe for signs and symptoms of toxicity and possible mortality, to know the dose that will kill 50% of the population in order to ascertain the lethal dose. And then the other set of animals used for diabetes studies, we are then used, diabetes was induced in those rats after the pre-treatment period. The rats were fasted for 16 hours, but with free access to water, after which they were given 50 mg per kg body weight of streptozotocin injected intraperitoneally. And so hypoglycemia was prevented 2 hours after the injection of streptozotocin by already giving the rats 5 ml each of 5% glucose solution. After 48 hours of the streptozotocin injection, blood was collected orbitorectally, and the fasting blood glucose concentration were determined. The rats with fasting blood glucose concentration greater or equal to 200 mg per kg were labeled diabetic. Group D and E were already prevented daily. We are already pre-treated daily with 100 and 200 mg per kg of ethyl acetate fraction of Costus afer, respectively, for a period of 4 weeks before the induction of diabetes. The essence of this is to see if the extract will have some preventive measures against the onset of diabetes or delay the onset of diabetes. After the induction of diabetes in all groups except Group A, that is the normal control, Group B was left untreated. Group C was treated daily with 100 mg per kg of metformin. Treatment with the extract at varying doses of 100 and 200 mg per kg was carried out daily for groups D to G for a period of 4 weeks. Fasting blood glucose concentration was determined before and after induction of diabetes and was determined at weekly interval during the period of pre-treatment and treatment until the completion of the experiment. At the completion of 8 weeks, that is 4 weeks pre-treatment plus 4 weeks post-treatment, Blood was collected by tail puncture, and fasting blood glucose concentrations were again determined. Blood collection was done by ocular puncture into ethyl diamine tetraacetic acid, that is EDTA bottles, and plain bottles for haematological and biochemical acids, respectively, before sacrificing the animals. The analysis that were carried out after the 8-week studies was hematological analysis, lipid profile test, lipid liver function test, lipid peroxidation, alpha amylase assay, insulin assay. Statistical analysis was done using SPSS, social sciences software for Windows version. Statistical package for social science software for Windows version 25 SPSS was used to analyze the data to find out or determine if a significant difference exists between the means of the test and control groups. And the limit of significance was adjusted at P less than 0.05. Results. Now we want to look at the results of these experiments. Result of the acute toxicity studies. The animals that we administered low doses of ethyl acetate fraction of CFR survived after 24 hours and then 14 days of the administration without any sign or symptom of toxicity, such as drowsiness, restlessness, or mortality. Another set of rats, we administered high doses of Costus afer. The rat that was administered 1,030 mg per kg body weight of ethyl acetate fraction of Costus afer was observed to be partly weak, while the rat that was administered 2,900 mg per kg body weight was observed to be very weak. Within 24 hours of administration of 5,000 mg per kg body weight of the fraction, death was recorded with observable signs of toxicity. And so the LD50 was calculated to be 3,807.9 milligrams per kg body weight. The result of the fasting blood glucose concentration. Now looking at the table, we see that the pre-induction of diabetes during the treatment period for 4 weeks, there was no significant increase or decrease in the fasting blood glucose levels of all the groups during the pre-treatment period. Then after the pre-treatment period, diabetes was induced. And when diabetes was induced, there was a significant increase in the fasting blood glucose level of all the groups that were induced, starting from group B, that is the diabetic untreated group, down to group G. You see that there was a significant increase. As you can see, the asterisk denotes significant increase in the fasting blood glucose levels. And so while the treatment commenced for another 4 weeks, after week 0 of induction, treatment commenced, we found out that the group B that was induced, but without treatment, their fasting blood glucose levels remained high. Then group C that was treated with a standard drug showed a significant reduction in their fasting blood glucose levels in week 3 and week 4 compared to the group B that was not treated. And so the group D that was pre-treated with 100 milligrams per kg showed a significant reduction in fasting blood glucose level in week 1, week 3, and week 4 compared to the diabetic untreated. Then group E that was treated with 200 milligrams per kg body weight showed a significant decrease in fasting blood glucose level starting from week 1 and proceeded to week 2, week 3, and week 4. And then looking at the group F that was not pre-treated before induction, group F was treated after induction, likewise group G. And what makes it different from group D and E is that group D and E, we are pre-treated with 100 milligram and 200 milligram per kg ethyl acetate fraction of Costus afer respectively for complete 4 weeks before the induction of diabetes. But group F and G, we are not pre-treated before the induction. And so looking at the group F showed a significant reduction in fasting blood glucose level in week 3 and week 4. Also, group G showed significant reduction in fasting blood glucose level from week 1, week 2, week 3, and week 4 compared to the diabetic untreated group, that is group B. Now we proceed to the next slide. The next slide shows us the result of the haematological analysis. Now we see that induction of diabetes really altered the hematological parameters of the animals. Now, looking at the hemoglobin level, you will see that there was a significant reduction in the hemoglobin level of the diabetic untreated compared to the normal control and compared to the groups that were treated. However, treatment was able to bring back the hemoglobin level of the different groups back to normal. Then looking at the PCV, we'll see that there was a significant decrease also in the packed cell volume of group B that was not treated at all, when you compare to the groups that were treated, which the treatment was able to ameliorate the effect of streptozotocin and bring up the packed cell volume close to the normal. Then we also see a significant decrease in the platelet concentration of the diabetic untreated group, that is group B, compared to the other groups, which were higher after treatment period. Then we get to the next slide. The next slide talking about result of the lipid profile test. We found out that the total cholesterol of group B that was induced without treatment really increased significantly compared to other groups. And then we found a reduction in the total cholesterol level of the treated groups compared to the group B that was not treated. Likewise, there is a significant increase in the HDL level, HDL concentration, that is high density lipoprotein concentration of the treated group, starting from group D, E, F, and G, compared to group B, which was not treated. So the HDL level of group B decreased significantly compared to other groups. Then the triglyceride level of group B increased significantly compared to the treated groups. Also, we see increase in the low density lipoprotein concentration of group B, comparing it with other groups. Likewise, VLDL, that is very low density lipoprotein cholesterol, increased significantly compared to group C, treated with the standard drug, compared to D with group D, and group E that was pre-treated before the induction of diabetes and later on post-treated. Result of the liver function test. The induction of diabetes using streptozotocin altered the liver function level, the level of liver function parameters. The ALT level, that is alanine transaminase level, was found to be almost normal, although there was an increase in the untreated group compared to the treated and the normal control group, but the increase is not statistically significant. And then there was also an increase in the AST level compared to the other groups. There was an increase also in the ALP level of the group B that was not treated. There was also an increase in the direct bilirubin and the total bilirubin of group B that was not treated compared to the treatment groups. Then the result of the lipid peroxidation test, alpha amylase test, and insulin test. In the result, you notice that the MDA level, that is the malondialdehyde level, which is the index of lipid peroxidation, increased significantly a negative control, that's a diabetic untreated group, when compared to the normal control group and the other groups. However, group D and group E showed a significant reduction in the malondialdehyde level compared to group B that was not treated. Also, looking at the alpha amylase activity, the alpha amylase activity of group B was high compared to group E, which was treated with 200 milligram per kg, which was pre-treated with 200 milligram per kg, and afterwards treated with 200 milligram per kg ethyl acetate fraction of CFR. Then looking at the insulin level, we observed that the induction of diabetes significantly reduced the insulin level of the animals. And then in group B, there is a significant reduction in group B, and then this reduction was not seen in the group that was treated with 200 milligram per kg of ethyl acetate fraction of Costus afer. And so group D and group E, group D, E, F, and G treated with the different concentration of the extracts showed a significant increase in the insulin level compared to the group that was not treated. Now, discussion. The result of the active toxicity study of the ethyl acetate fraction of CFR suggests that the fraction is not very toxic, and that is why the value of the LD50 value is 3,807.9 milligram per kg body weight. The pre-treated groups were more active during the treatment and responded to treatment better compared to the groups that were only treated after the induction of diabetes. In other words, these groups that were pre-treated, that is group D and E, fared better in the course of the experiment, not showing the adverse effect of the induction of diabetes, compared to the groups that were not pre-treated before the induction of diabetes. So this agrees with the results of our earlier study on medicinal plants using neem leaves. The groups that were pre-treated before the induction of diabetes were agile after the induction of diabetes, showing that the extract can boost their immunity and protect the RAS from the severity of diabetes and possibly delay the onset of diabetes. Pre-treatment and treatment with 200 milligram per kg body weight of the extract also caused a significant reduction in the aspartate transaminase enzyme, alkaline phosphatase, direct bilirubin, and total bilirubin level compared with the diabetic untreated control. As reported by Ezeigwe et al., an increase in ALT, AST, and ALP in diabetic RAS and the restoration of these enzymes after the administration of CFR extract. And so, Gupta has reported an increase in the levels of these enzymes in diabetic patients, especially in type 2 diabetic patients. Administration of ethyl acetate fraction of the ethanol extract of CFR decreased alpha amylase activity. However, this decrease was only significant in the pretreated and treated group with 200 milligram per kg of the fraction. This suggests that the anti-diabetic property of the ethyl acetate fraction might be because of its capability to inhibit the alpha amylase enzyme activity. And so this agrees with the findings of Dye et al., who stated that type 2 diabetic patients have lower alpha amylase levels and that a high level is protected. The insulin level will increase in the groups administered with the ethyl acetate fraction of CFR leaf. The anti-diabetic property of CFR might also be through the regeneration of destroyed beta cells of the pancreas. Diabetes mellitus can be effectively managed by any substance that can act directly on the pancreas, thereby stimulating the release of insulin, which have the capability of lowering the blood glucose concentration in the blood. Conclusion. The findings of this research reveal that ethyl acetate fraction of Costus afer might be used for the prevention, treatment, and management of diabetes mellitus. The fraction also has good safety profiles as evidenced by their favorable effects on the haematological and biochemical indices, thereby capable of ameliorating the symptoms and complications of diabetes mellitus. Thank you for listening. Thank you very much. That is the